Beautiful people of Lagos, Nigeria, Africa, and the rest of the world. It is, of course, another exciting episode of Healthmatic from your number one spot for online radio entertainment. And I am your humble host, my humble self, Olabisi Williams Great. Today, we are going to be talking about diabetics. It is, of course, a menace disease that has eaten deep in our society of today. We have today diabetes in women, diabetes in pregnant women, diabetes in men, diabetes in children. In fact, diabetes is not just gone are the days when we used to believe that diabetes is an old age disease. Nowadays, it's no more. It is what affects our norms, the social norms, the people out there, you and I out there. As you see today, it is automatic. And of course, I would always want to discuss this, most especially anything that has to do with health with one person, one and only person that God give that same respect for. I'm talking about no other person but the person of Dr. Triumph Blessing Adeniji, the CEO Triumph Orokuta Hospital. Is here in the studio, of course, to make sure that today's episode of Healthmatic will be one memorable one. You may want to introduce yourself to your audience, sir.
Thank you very much. I want to welcome every one of you to this episode of the topic we are talking about, diabetes. I'm Dr. Adeniji Blessing Adetuji, the MD, Triumph Orokuta Hospital.
Thank you very much, sir, for that brief introduction. But before we go into that very detail of today, we will quickly rush down and we'll be right back with just a few minutes. If you're just joining us, you know you are with us on today's episode of Healthmatic. From here, your own station, our own station that is the first and the last. We're talking about online radio entertainment. We'll be right back. Welcome back, beautiful people of Lagos, Nigeria, Africa, and the rest of the world. If you're just joining us, of course, you've not missed a lot. It is Healthmatic. And today's episode promises to be very much educative, promises to be very much entertaining and edutaining. At the same time, we are going to be discussing that disease, diabetes. We want to know what are the causes of diabetes, what are the controls and the kinds, the forms of treatment, what are the symptoms, what are the predisposes factors of Healthmatic, and if it must be cured, what is the cure? If there's no cure, what is the control? On today's episode of Healthmatic. Sir, today is another one to talk about that very big disease that the whole of the world is talking about as of today, diabetes. Gone are the days when we believe that diabetes is actually some old age ailment. Sir, what is diabetes as of the world of today in relation to the world before now?
Well, diabetics is a disease that is very common among the whites, among the black, and everybody in the whole world generally. And all is just because of one organ in our body called pancreas. This pancreas is an organ that is responsible for the production of insulin that regulates the blood sugar. Now, diabetes is just simply defined as abnormal increase in the blood sugar. If you are talking about abnormal, what is normal? The normal blood sugar of an individual, when it has not eaten, we call it fasting blood sugar, is between 70 and 110 milligrams per deciliter. If somebody have eaten, it is supposed to be between 100 and 150 milligrams per deciliter, 100 to 150 milligrams per deciliter. Now, what happened? What brings about abnormal increase in the blood sugar? It has something to do with this organ called pancreas. And every human being in the whole world has pancreas. There's some other animal that also has pancreas. But basically, the disease of diabetes is a disease that has to do with pancreas. Now, this pancreas is an organ that is found in our abdomen. And it is an organ that is responsible for two things. Number one, it's an endocrine gland. At the same time, it is also an organ that produces digestive juice. So the endocrine part has to do with pancreas producing insulin and glucagon. This insulin brings down the blood sugar after we might have finished eating. If the blood sugar is extremely low, glucagon responds for the increase in the blood sugar. And the glucagon and insulin, they work hand in hand in order to maintain a normal blood sugar in the body. Now, this same pancreas also produces what we call digestive juice. These digestive juice are substances that are responsible for digestion of foods like carbohydrates, protein, fat, and oil. But today we are talking about diabetes that has to do with carbohydrate food. So the pancreas produces an enzyme called amylase. This amylase breaks down the carbohydrates and end up in producing glucose.
Okay.
And this glucose is what the body needs for us to function well. Now, the glucose or sugar in the blood supposed to get into the cell. When it gets to the cell, it further go through a process called glycolysis and eventually produce ATP. And this ATP is a substance that helps in all the enzymatic reaction that takes place in the body for us to see, for us to hear, for us to talk, for us to move body, for all the organs of our body to function. They need ATP for their enzymatic reaction in order for the body to be functioning normally. So when this thing is not happening, it means there is a problem with sugar. Now, this insulin, its main function is that when we eat food now, that is carbohydrates, the blood sugar can go up like 400 or 500. Now, the pancreas will produce the insulin. The insulin should be able to take the sugar from the bloodstream into the body cells. At the same time, the body cell also should be ready to receive the glucose that insulin is bringing to it.
Okay. So it's a give and take thing.
Yes, it is two things. Either the pancreas produce insulin that is enough to mobilize the sugar into the cell, or the cell itself did not respond to the sugar that insulin is bringing into it. So as a result of that, there will now be excess blood sugar in the bloodstream. And once there's excess blood sugar in the bloodstream, it affects all the system of the body. And that is why diabetes can equally be described as a multi-systemic disorder.
In the body. As you've heard that, it is a multi-disorder. It's a multi-systemic disorder in the body that actually leads to all of this. Now, we want to understand deeper, and I know somebody out there will want to find out, sir, that what are the types of this diabetes we really have? Do we have types? And I know of type A, type B. I can't really differentiate each of this.
Yes. Diabetes is grossly divided into two. The one that are common in the clinical practice. And that is type 1 and type 2. Now, what is the difference between type 1 and type 2? In type 1, this same pancreas we are talking about, probably it does not produce insulin at all.
That is in type 1.
In type 1. And in such a situation, the patient have to be on insulin injection for life.
Whoa. That's something.
That's type 1.
Wow.
Then type 2, the pancreas has not completely stopped working.
Oh.
It is still producing insulin, but the amount of insulin it's producing is not enough to meet up with the regulation of the high blood sugar in the body system.
Whoa. So it is safe to say this is the difference between the both. One is live insulin requirement, and one is not live. If, of course, we can treat it to a point where the body can now regulate itself and give back that to that insulin. It produces insulin. Are we saying that it is safe to say, okay, one is needing insulin for life and one is not?
How do we describe it is this? Type 1 is referred to as insulin-dependent diabetes.
Oh.
While type 2 is non-insulin-dependent diabetes.
Wow.
The first one, which is type 1, will be on insulin injection for life. Type 2 will be on oral hypoglycemia. Those are the drugs that bring down the blood sugar. Because the pancreas is producing insulin, those drugs will just help the insulin produced by the pancreas to regulate the blood sugar.
Wow, fantastic, fantastic. Now, I want to find out, of course, it's still dealing with type 1 and type 2 of the diabetics we have. What can we really attribute diabetes to, it being its cause in the general body system of every man on earth today?
The diabetes of a thing, it is a disease of pancreas. And this pancreas, as I said the other time, it is an organ that produces insulin. If the pancreas is producing insulin normally, nobody will end up in having diabetes. Because as you eat and the blood sugar shoot up, the body produces insulin and regulates it. So anything that can affect pancreas, for example, if pancreas has an infection, and there's a pancreatitis, inflammation of pancreas as a result of infection, either bacterial infection or fungal infection or viral infection or parasitic infection, that alter the function of pancreas, it can make the pancreas not to produce insulin.
So generally anything that can affect the pancreas?
Yes.
Wow.
It could be cancer of the pancreas.
Oh, we still have cancer of the pancreas?
Cancer can affect any part of the body.
Wow.
So pancreas is one organ that could be affected by cancer. Apart from that, there may be people that may be involved in accidents and have injury to the pancreas.
Wow.
So there are some drugs that some people can take that can make their pancreas to function abnormally, and thereby leading that individual to diabetes. So the diabetes can be also a kind of inherited or something that one is being born with, especially if there is in a baby that probably the parent is diabetes and their DNA is already transferred into that baby can call it develop diabetes. It is possible. And that is what we call juvenile diabetes or infant diabetes. Then a pregnant woman also can have diabetes, and that's what we call gestational diabetes. So it depends on what is the cause of that diabetes that will determine the type of diabetes that we talked about, and it will determine the management or how to treat such a diabetes.
Thank you very much, beautiful people of Lagos, Nigeria, Africa, and the rest of the world. You will take it with me that, of course, we have picked the right onion when it comes to the topic diabetes, and the person to take us in the journey of knowing what diabetes is and the causes of diabetes. As we've discussed so far, so good. And of course, don't go nowhere. We want to quickly go back to that commercial, and we'll be right back. Don't go nowhere. It is Healthmatic, and I remain my humble self on Labisi Williams Great. I'll be right back. Beautiful people of Lagos, Nigeria, Africa, and the rest of the world, I want to say a big thank you to you for being with us. And if you're just joining us, of course, you have not missed much. We've only been talking about diabetes here today on today's episode of Healthmatic on your favorite station, your number one spot for online radio entertainment. And the doctor here in the building is Dr. Blessing Triumph Adeniji, the CEO of Triumph Orokuta Hospital, who has been talking in-depth and giving us in-depth analysis about diabetes. Now, sir, a whole lot of persons might have been listening to us, and some may have just been joining us on this episode of today's Healthmatic. I want to talk about the common diabetes. What are the common, how common can we really say diabetes is? It's not just in our society, but in the world at large.
Actually, The type of diabetes have been described before is what we call diabetes mellitus.
You said diabetes?
Diabetes mellitus.
Oh, that's a medical terminology
yes,
for that.
This is describing the type 1 and type 2.
B. Oh, okay.
Type 2.
Type 2.
Then there's another type of diabetes called diabetes insipidus.
Okay. Insipidus.
Diabetes insipidus. Diabetes insipidus is different from diabetes mellitus. And diabetes insipidus is not common because it is a disease that affects an hormone in the body. Now, there is a gland called pituitary gland or master gland that is found in the brain. This pituitary gland is a gland that has the anterior lobe and posterior lobe and divided by ischium. Then above it is what we call hypothalamus. This hypothalamus is a structure, a neural cells that releases some factor to instruct the pituitary gland to produce the hormone in the anterior lobe or hormone in the posterior lobe.
Oh.
Now, at the posterior lobe, because that is what we are concerned about because of diabetes insipidus.
Insipidus, yes.
At the posterior lobe, this posterior lobe secretes 2 hormones. Number 1, antidiuretic hormone and oxytocin. Now, the oxytocin, we are not going to that today because it has to do with uterine contraction and helping the breast to inject milk.
Oh.
But the antidiuretic hormone, from the name implies, it prevents excessive production of urine from the kidneys. Now, when there is an injury or there is anything that affects the posterior pituitary gland, this hormone may not be produced enough antidiuretic hormone in order to control the amount of urine that is coming out or that the kidneys is producing. So when there is a copious production of this antidiuretic hormone in the system, it challenges the kidneys, and kidneys tend to produce urine, and the patient end up in what we call polyuria. Are we together? Yes. So polyuria. Now polyuria is excessive, urination. Now, the difference between diabetes mellitus and diabetes insipidus now is this. In diabetes mellitus, there's polyuria, there's polyphagia, there's polydipsia. Polyuria, excessive production of urine. Polyphagia, that is when somebody is drinking excess water. Polydipsia, that's when somebody is thirsting for water. Now, the same thing applicable to diabetes insipidus. But the only difference between two is that in diabetes mellitus, there is excess blood sugar in the body, but in diabetes insipidus, there is no excess blood sugar. So when you check that patient blood sugar, it remains normal. Both the fasting and random, they remain normal. And that is just the major difference between the diabetes mellitus and diabetes insipidus.
Thank you very much for that explanation. Now, if we must talk about the risk factors, the predisposing factors to diabetes, can we please go into this so we can know the listeners, your subscribers out there who are watching us can also have this better understanding as regards the predisposing factors of diabetes?
Fine. When we are talking about predisposing factors of diabetes, we are talking about what are those things that can make an individual prone to diabetes. For example, diabetes is hereditary. If parent has diabetes, it is possible for that child to become diabetes because of the fact that he inherited it from the parents. And that is one of the things that can make an individual to have diabetes. It is a predisposing factor. For somebody that the parents are not diabetes now, the issue of hereditary making an individual becoming prone to diabetes will not be there. Now, apart from that, another thing that can predispose an individual to diabetes is if the pancreas itself has injury. And the injury was so much to the extent that the thing will destroy the pancreas completely. Then there is no any other organ that produces insulin apart from pancreas. So that individual could be predisposed to diabetes. Apart from that, there are some virus that when it enters into the body system, or there are some antiretroviral drugs we use to treat HIV or treat hepatitis that can equally have effects on the pancreas. And when they have effect on the pancreas, they alter the function of pancreas. And once the pancreas function is altered, then the insulin production becomes altered. And then the blood sugar increases abnormally. That could be another predisposing factor. Then there are some chemicals that some people can expose to that can only have effect on the pancreas. And then there are some diseases like cancer of the pancreas that can predispose an individual to diabetes. Then there are some autoimmune reaction that can predispose an individual even to diabetes. So apart from all this, there are some people that overindulge in carbohydrates. Some people will take soft drink about 4 or 5 bottles in a day.
On a daily basis. Having gala, having different kind of course, yes. Not mentioning any form of brand name here.
So at the same time, some people can take like eba, take bread, they take inyo, take fufu, and then they keep on taking it every day without adding vegetable. They don't take fruits, they don't take beans.
Basically balancing the diet.
So they just eat only one type of class of food. Meanwhile, there are 6 classes of food that are supposed to be in the food to make the food a balanced diet. So if people are in such a situation, they just discover that they overuse their pancreas, and once you overuse the pancreas, there's tendency for pancreas to be worn out. And when the pancreas worn out, it won't be able to perform its function in producing what we call insulin that will regulate the blood sugar. Now, there's some people that are obese.
Fantastic.
So when these people that are obese, the blood vessel, the fats in their body can equally be deposited at the wall of the blood vessel and make it thicken. By the time it becomes thick, it narrowing the flow of the blood and thereby reduces the blood supply to the pancreas, and pancreas will not be able to perform its function as is expected. And then age is another thing. There are some people by the time they are age 40, they don't take caution on what they eat, and as a result of that, the body system is subjected to tearing and wearing.
Yeah.
We are getting older, the body organs are getting older, they are not being active as expected. As a result of that, it can predispose that individual into diabetes. So there are other things that can equally make an individual to have diabetes. If somebody is hypertensive is another disease that can throw some people to diabetes, because they are just like twins.
Like twins, working intertwined kind of.
So in practice, most of the people that have hypertension tend to have diabetes. Tend to have hypertension, and there are some people that have only hypertension. Some have only diabetes.
Wow. So with what we just have in this explanation, that is very beautiful and brilliant. Thank you for that in-depth analysis, sir. I want to come back to that symptoms. If one is diabetes, what are the things he or she, be it old or young, should be looking out to and say, okay, so that we know I'm having diabetes, or am I, before going for that checkup that will actually confirm it? What are the symptoms that people should be looking out for when it comes to diabetes, be it type 1 or type 2?
Fine. The diabetes mellitus that we are talking about, type 1 or type 2. Number 1, that individual will notice that he's urinating more than
excessively.
What brings about excessive urination is this: glucose or sugar in the body is like a poison. that can damage the nerves, damage organs in the body. As a result of that, the kidney is sensitive to this. Kidney, in attempt to flush out excess sugar, it has to be through urination. And that's what brings about excessive urination.
Wow.
Always excessive maturation. Now, that is one. We call it polyuria. Somebody that is urinating excessively, the body fluid will get reduced.
Thereby leading to.
And the body will signal to the body and say, the body fluid is reducing. Begin to have tests.
So
and as he's having taste, he'll be tasting for water.
So he drinks more water.
He drinks more water. So that tasting now is polydipsia. And then polyphagia is excessive consumption of water. So as he's taking more water, he's not satisfied.
Yes, he wants more.
He wants more. Somebody that's in the night when he sleep, maybe around 9, by 5 a.m. he wake up, he doesn't urinate throughout the night. Now discovered that you urinate 3, 4, 5 times over the night. Not that the person has drank too much of water in the night before sleeping. He just discovered that he was just urinating excessively over the night. So polyphagia, polyuria, and polydipsia, these are 3 major signs that are common with diabetes. When this thing happens, it disorganizes the whole body because there's something we call homeostasis, equilibrium. The amount of water you take in must be equal with the amount of water that is getting out of the body. As it is, 3 liters of water are supposed to get into the body, and 3 liters of water to get out of the body on a daily basis.
Sure.
Through urine, through sweating, through inspiration, and then through talking, through saliva that you spit out. All these things calculated together making 3 liters. And that is why the 3 liters of fluid we are talking about, it means that one has to make sure that it can be 3 liters of water in order to maintain homeostasis. But in this situation, this person is urinating excessively. And as he's urinating excessively, the body weight begin to go down. Not only that, the glucose in the body is useless to the body because it doesn't have access into the cell, where glycolysis will take place and give us ATP that the body needed. The body will now look for what we call precursor. Precursor are the adipose tissue, the fat in the body. We now have to break it down and convert it to glucose in order for the body to get energy.
There's somebody out there hearing that.
So it's a kind of coping mechanism.
Oh my goodness. So naturally when one has diabetes and is becoming lean, this is just what is going on within that body system.
Exactly.
You hear that, somebody? Check what you eat and be sure that you are very, very sure that you are very much careful about what you put into your system, about your the history of your health. And of course, when you begin to urinate excessively or you begin to get thirsty excessively, it is nothing but a symptom for you to begin to go out for check on that disease, diabetes. Don't go nowhere. We'll be right back. The show continues shortly. Welcome back, beautiful people of Lagos, Nigeria, Africa, and the rest of the world. Thank you for being here with us. If you're just joining us, though, you have not missed lots. We've been able to talk about diabetes on today's episode of Healthmatic, on your number one spot for online radio entertainment, TE for short. Now, our phone lines are open. You may want to reach us on our phone lines. You may want to call us. Our phone lines are open. The numbers to call are 090 20771694. Same on WhatsApp. You can reach us on WhatsApp. You want to go through and connect with us on our social network media handles, all of which it's all about Triumph Edutainment. And that's the way entertainment. That is the way to go about it. When you get to Facebook, just type in the word Triumph Edu Radio. One word, Triumph Edu Radio. The same goes on Instagram, Twitter. The same goes down to LinkedIn. Even on YouTube, it is Triumph Edu Radio. And of course, we are still on that same topic, sir. Diabetics. Our phone lines are going to be open, and lots of calls will be coming on our social network handles. We already start receiving messages where people are asking questions about this topic. But then, sir, we want to really go in depth about this. Now, we've been able to understand the causes, the symptoms. Does this disease has cure?
Diabetes medically is not curable, but it could be controlled.
Ooh. Okay.
So why I said it is not curable is that the pancreas is the organ that is responsible for the production of insulin that regulates the blood sugar. And now is diseased. And this person has no spare.
Wow. So even now, it's about not having the peers to actually have this thing back. But of course, the only way we can go about it is control.
It's control.
Okay.
Controlling what you eat. Make sure you check your blood sugar regularly. Make sure you visit the doctor in order for you to be monitored accordingly and give medical advice that will help you maintain your health, and then just like that.
So are we saying that early detection is the major cure here? If what you said now.
Early detection will just give us early diagnosis, not cure.
But control.
Control.
Now, for those who are out there who actually had been noticing these abnormalities in their urine, in how thirsty they've become over say period in recent times, and then they begin to notice these things. And as Nigerians, as Africans, we want to go in the way of self-medication. Now, how do we get to handle this in the way of self-medication?
When self-medication is deadly. And what makes it deadly is that you don't understand yourself as Dr. Drew. And because you don't understand yourself, there is possibility for you to do contrary and kill yourself as a result of self-medication. For example, there was a patient that has diabetes, and he knows that he had diabetes. Then he used natural herbs or natural remedy. And the person told me that he should get snail water with honey and be drinking it every day. This person continued taking it until the blood sugar go high above 1,000 milligrams per deciliter, and he went into coma.
That's when he realizes the folly.
So when he goes into coma, he became comatose now. They have no option than to rush the patient to the hospital. And by the time he got to the hospital, it was discovered that he has a very bad diabetes. Now, what am I trying to say is that if he has come to the hospital, he has seen a doctor, the doctor will have made appropriate assessment and diagnose the patient and give appropriate treatment. Are we together?
Yes.
And give appropriate treatment. But because of self-medication he did, then there's a problem.
It was a bit too late.
Yes. And then there are some people that really they are using orthodox medicine. They just believe that, okay, my uncle is having diabetes. This is drug my uncle is using. I too, I have diabetes. I have to be using the same drug. It doesn't go like that. Now, there are some diabetes that are serious that they don't respond to mild form of hypoglycemia. That probably you have to give high dose to that patient in order to regulate the blood sugar. And then there are some people that their diabetes doesn't need drug, doesn't need insulin, it only need us to cancel them on the food that they be eating and they maintain their life.
So are you saying in essence that as a diabetic patient, they have the kinds of food that they're expected to be taking at that state of diabetes?
Yes. Yes. something we call diabetes diet.
Oh, okay.
Diabetes diet is the diet given to a patient the appropriate meal that the body can cope with in order to maintain its diabetes.
Oh, fantastic.
For example, we know for sure that diabetes is a disease of carbohydrates, food that gives energy. Now, and that carbohydrate is one type of the class of food out of 6. Carbohydrates, protein, fat and oil, vitamin, mineral, and water.
Okay.
These are the 6 classes of food. Now, all these foods supposed to be in quantity, in appropriate quantity and amounts, so that you need to have a balanced diet at each meal. So a diabetes patient have to be careful that he doesn't take too much of carbohydrate. Not that he's not going to take carbohydrate at all, because he still needs sugar.
Even at the state of diabetes,
yes,
you still need the same sugar. Wow. Fantastic.
Because sugar will give energy.
Energy, yeah.
So, but you need that in minimal amount in order to maintain his body. Then protein, like fish, meat, egg, beans, plant and animal protein are very important. You still need vitamins that will equally help in building the immunity of the body. You still need fat and oil at a mild quantity, and you need roughage.
Wow.
Are we together?
Yes.
So all these things are the food that he needs. And some people will still continue taking alcohol with diabetes. That person is killing himself. Or somebody keep on taking soft drink that contain high sugar, that person is killing himself. Or person is taking honey, because honey is a complex sugar, that person is killing himself. So the food an individual eats when he's having diabetes is very, very important in regulating the blood sugar. He shouldn't take carbohydrates in excess, but moderately, but he should take more of protein, vitamin, and mineral, so that he'll be able to reduce the function of the request of insulin in regulating the blood sugar. Because protein doesn't need insulin. It is another enzyme, like peptides, that it needs in order to break it down into amino acid, which is useful for the body, for body build.
Okay. At this junction, you've been able to let us know and understand exactly what this analysis is telling us about food and about what to take and what not to take. But then, I want to ask this question, because I know somebody out there is thinking, what are the types of tests one should go for when you are having that symptoms? You begin to think about, you begin to feel that you're thirsty excessively, you're urinating excessively, which is not like that before. Now, this person wants to come to the hospital, regardless of the fact that, okay, I don't have money, because money is a factor to them. When they say, I'm supposed to go to the hospital, I cannot. I'd rather use app because of the cost. Now, what are the tests they are expected to come that is actually making them run back and taking the other way around of self-medication?
When ignorance kills like cancer. And I keep on telling people that money is not everything. But in a situation where you notice there's something going wrong in your body system, go to the professionals. If your vehicle is having issue, go to mechanic. If you are having issue with your head, come to the hospital to see the doctor. Now, to diagnose the diabetes becomes very easy and simple. When the patient comes to the hospital and he lay down this complaint, the doctor will have in his mind that this patient may be suffering from this also disease, and then we order for laboratory investigation. One of the tests we always order for is to check the blood sugar before the patient eats, and that is fasting blood sugar. I want to check, I said the other time that the normal fasting blood sugar result is 70 to 110 milligram per deciliter. So when the person has not eaten early in the morning and he check the blood sugar, and the blood sugar come out to be 350 milligram per deciliter, then it is suspect.
What will now happen when the person now eventually eats in the day?
So Then another one is random blood sugar. The random blood sugar is also used to check the blood sugar after a person might have eaten. And the range for that is between 100 to 150 milligrams per deciliter. So anything outside that, then we diagnosing that individual to be diabetes, coupled with all other signs and symptoms complained by the patient.
Thank you very much, Dr. Blessing Triumph Adeniji. It has been a very wonderful section with you today. I'm going to talk about this topic for today, diabetics. Now, I want to be sure that you are there listening to me. You're in your confine, the comfort of your home. You are in the office, you're driving, you're just coming back from the office, or you are perhaps in some other countries where we are not even in the same time zone as it is here in Lagos, Nigeria, where we are broadcasting from. I want to tell you that this is the broadcast of Triumph Edu Radio, broadcasting live, direct from here in our studio, here in the heart of Lagos, in Ikorodu precisely. And I'm very proud to say that. Now, we've been able to itemize what are the causes of diabetes, what diabetes is. I want to be sure that we've been able to touch what diabetes is for today and the causes of diabetes. Of course, the cure and controls of diabetes. But before we wrap up for today's episode, sir, we quickly want to add, like it is our tradition here on Healthmatic, whenever we have professional in this field will come, will tell us, okay, what is the mathematics of health tips for today and for this week?
When, if you are sick, you keep yourself at home, you will die. But if you come out to the hospital, you'll be diagnosed and be treated, then you live.
Wow. Fantastic. So, for those who are just meeting you, or for those who have watched your episode with us here before, as we've had in the likes of high blood pressure and the likes of them, what more do you think you want to give to them as a message, as an advice, most especially in the area of self-medication, sir?
Well, self-medication is deadly, and we don't even encourage it because every drug is a poison. So, taking poison into your body system, to biological system, damages it. So when you are sick, you take drug and you are fine, forget about drug, continue with your life.
Very wonderful. Yes, you may want to reach us again or across all our social network media as we go all out here from this studio today on this episode of Healthmatic, where we discuss diabetes today. The handles to reach us on Facebook is www.facebook.com/Triumph Edu Radio, one word, and that goes across all our social media. And of course, our website is www.triumpheduradio.com. You may want to reach us on our email. It is eduradiotriumph@gmail.com. And like I said, the numbers to reach us, be it on WhatsApp, or you want to reach us, you want to call, you want to chat up with us, it is 090-2077-1694. That is the number to reach us, both on WhatsApp and of course direct line. Day in, day out, 24 hours we run, and we'll be ready to receive you day in, day out. Thank you for being with us. Without you, today's episode wouldn't have been a success. It is a huge success because you are there and we are here. It is your program, our program, Healthmatic, and I will say, like I will always say, be good citizen and do well to check up very much on your health. I remain my humble self, Olabisi Williams Great, and we will see same times, same station, and of course in the next episode of Healthmatic. Bye and remain blessed.
Audio Jungle.